Hi everyone, my name is Abby Wendt. I'm a senior undergraduate student studying statistics. Today I'm going to be talking about statistical modeling of statin use and traits among participants with high lipid levels. So this project was completed in the Burkhart Consulting Center, which is a statistical consulting group at NKU that offers support for research and publication for NKU students, faculty, and members of our community, including regional healthcare organizations. So one of the greater problems that's affecting patients today is high cholesterol, which is often treated using statins. We use logistic regression models to study statin prescription use in patients with various levels of cholesterol and other health characteristics. So there were 5 case groups in this study that were based on 2 Dutch lipid clinic network categories, which were possible and likely, meaning they were possible or likely to have high cholesterol, as well as family history of high cholesterol and getting criteria. The control group was comprised of those who were in the unlikely DLCN category, which meant that they were unlikely to have high lipid levels. And these case groups were all analyzed individually and then compared to the control group to see if there were differences in statin use. So logistic regression is a statistical technique that's used to estimate the prevalence of a binary outcome variable. So in this case, we were using it to predict the use of statin in each group while we adjusted for various factors, which included age group, smoking status, comorbidities such as diabetes or heart problems, hospital network affiliation, insurance carrier, as well as whether or not they saw a specialist. So we created confidence intervals which showed potential differences in case and control groups. And we did this analysis for both high-dose statin and any dose statin prescriptions. So one of the subgroups that we looked at, as I said before, was smoking status. So patients were either never, former, passive, or current smokers. When sample sizes were too small or less than 50, we did not consider them because they wouldn't be large enough to draw conclusions from. So this table here shows the prediction of high-dose statin for those who are in case group 3, which is those who are identified using the getting criteria. So we can see our control group percent is the confidence interval, the prediction of those getting statin for the control group, and then the case group percent is the interval showing those in case group 3 who got statins. So what we can say from this, our case group percent intervals are all entirely above our control group percents, which means that they're all significantly higher than them. So more participants in case group 3 are given statins regardless of their smoking status. If we look within the levels of smoking status of the case group percent, there's no significant difference between these 4 levels. So there's no significant difference between the smoking levels within group 3, as these are all overlapping. And in this case, the passive smokers had a sample size of 10, so they were not considered because it's not large enough to draw conclusions on. So the full analysis of this project produced lots and lots of tables, but one of the main themes is that many of the case groups, which is the people who have higher cholesterol levels, were given statins more often regardless of their characteristics, such as smoking status or comorbidities. So this is an ongoing project in the BCC, and we hope to, in the future, examine multiple factors, including the interactions of different characteristics. We want to restructure the data to allow a more complex model to be examined and look for interaction effects while controlling for characteristics among these participants. So the data that was used in the study is from Dr. Whale Eade at St. Elizabeth Physicians, and it was conducted at the Burkhart Consulting Center. Thank you very much.